Welcome back to Face the Nation. There are growing concerns about B.1.1.7. That's the new strain of the coronavirus first discovered in the United Kingdom. So far, the highest number of cases from that strain have been found in California. CBS News correspondent Jamie Yuccas is in hard-hit L.A. County.
Margaret, L.A. County is home to half of the COVID-related deaths in the state, and roughly 1 in 3 here have been infected with the virus since the pandemic began. It's also home to Dodger Stadium, now the largest vaccination site in the country.
It's been a slow start for vaccinations in California, but officials believe by next week, healthcare workers in the state will be able to administer 40,000 doses a day.
There's a little bit of waiting, but the actual vaccination went really fast and it was painless.
But there are mounting concerns the supply of vaccine doses could run out. California, like other states nationwide, was expecting an uptick in shipments after the federal government promised to unleash a reserve supply.
They have reneged on that, or for whatever reason are unable to deliver on that.
The Trump administration says governors misunderstood.
We're not sitting on a reserve anymore. We've made that available to the states to order.
Hospitalization rates in California have fallen, but many hospitals are still well over capacity, with a Californian dying of coronavirus every 3 minutes. The pressure to get people vaccinated across the country is mounting as a new CDC study shows a more contagious strain of coronavirus, first discovered in the UK, could become the dominant strain in the US by March.
If this virus does have a higher reproduction number, if it is more transmissible, that makes it harder to control.
Dr. Anthony Fauci is distraught that with the U.S. death toll topping nearly 4,000 a day, some still don't believe the disease is real.
I think the answer is not going to be to just blow them aside and say you're crazy. We've got to engage and figure out what is it that separated us so profoundly.
Despite the growing push to get as many Americans vaccinated as quickly as possible, this is a race against time, with thousands still dying from the virus every day. The U.S. is expected to surpass 400,000 deaths this week. Margaret?
Jamie Yuccas, thank you. Worldwide, we've now passed 2 million deaths due to this pandemic. Liz Palmer reports from London.
Good morning. Ambitious vaccination programs are now getting underway on almost every continent, though as you might expect, they're moving ahead fastest in the rich countries of the developed world, where the United Kingdom is one of the front runners. This week, historic churches in England became vaccination centers. As the organ played, local elderly people got their shots in Salisbury Cathedral.
We've been on this site for 800 years. For 800 years, we've been about two things: giving glory to God and serving the people of this city and region.
The UK is now on track to have all medical frontline workers and those over 80 done by mid-February. In the developing world, India is leading the way. Hospital worker Manish Kumar got the very first shot this week. There are 300 million more on the first wave priority list. But there's a confidence problem. Many don't trust one of the vaccines, not because it was developed in India, but because it was rolled out before trials ended. Then there are countries like South Africa which must still focus on treatment because they haven't got a single vaccine dose. And this just as a new, more contagious strain is racing across the continent. Another new strain has emerged in the Amazon, overwhelming Brazilian hospitals. And it's a worry because no one yet knows if the current vaccines are effective against it. Meanwhile, in China, the World Health Organization's team finally landed in Wuhan to examine the origins of the virus. But 2 of them tested positive, and the rest are in quarantine until the end of the month. Because of those new coronavirus mutations, more stringent travel restrictions are springing up. Here in the UK, for example, nobody is going to be allowed in as of Monday unless they can show a negative test less than 3 days old. Margaret?
Liz Palmer in London, thank you. We want to go now to the incoming Biden administration's CDC director. That's Dr. Rochelle Walensky. She is also the chief of infectious diseases at Massachusetts General Hospital. She joins us from Boston. Good morning to you, doctor.
Good morning, Margaret. Thanks for having me.
We are already at 4,000 cases a day. The outgoing CDC director, deaths a day, the outgoing CDC director says we're about to be in the worst months. Do you agree with his forecast that it's going to get worse?
Unfortunately, I do. I think that, we've, as you noted, nearly 4,000 deaths a day, almost 400,000 deaths total by the middle of February. We expect 500,000 deaths in this country. That doesn't speak to the tens of thousands of people who are living with a yet uncharacterized syndrome after they've recovered. And we still yet haven't seen the ramifications of what happened from the holiday travel, from holiday gathering, in terms of high rates of hospitalizations and the deaths thereafter. So yes, I think we still have some dark weeks ahead.
How often is the public going to hear from you? Are you going to brief regularly?
I will brief as often as I can, as often as new information comes. I also want to make sure that the subject matter experts at the Centers for Disease Control and Prevention, who have been reading and reviewing the literature, understanding the science, you hear from them. When there are new things to report, you will hear from somebody at the CDC, and it may very well be me.
Well, we hope to continue to get that new information, Doctor, because there's a lot of questions right now about these reports of new strains out of the UK, out of Brazil, out of South Africa. What are you hearing? What concerns you about these new strains?
So the first thing I want to indicate is that viruses mutate. We've known for a long time that viruses mutate. It's not just coronavirus, it's many viruses, and they mutate when they're under pressure. There is a lot of pressure right now because there's a lot of virus circulating out there, especially in this country. When we see these mutations, we worry about several things. We worry about whether they have increased transmissibility. We worry about whether they have increased morbidity and mortality. We worry about whether they will evade our mechanisms of either treatment or our vaccines. So far, the one from the UK looks like it is more transmissible. We don't have any more information about whether it evades our vaccines. We have indication that it likely does not. But what increased transmissibility means is there are more cases and therefore more deaths. There are certainly further studies that are looking at the South Africa strain, at the Brazil strain, at other strains in Nigeria. And one of the things that this really demonstrates is our need to be vigilant and to have resources to do the surveillance to make sure we understand what strains are here and whether we have increased transmissibility and vaccine efficacy.
The CEO of Eli Lilly has said that they have indications that the South African strain at least shows some resistance to current treatments. Do you have indication that it does as well?
I have heard the Lilly antibody. This is the monoclonal antibody that we've been using for early stage disease, and I have heard similar things. It is one antibody. The Regeneron is an antibody cocktail, and I think that there is concern that not just the South African and the Brazilian strain, but other future strains might have resistance to those antibodies. Not taking off all efficacy, but decreasing their efficacy.
You just said something I want to go back to on the question of surveillance, and that is basically, why don't we as a country have a better system to detect which virus, which mutation, and where it is? How are you going to fix that?
I think this really just gets to the resources that are necessary in this country for an adequate public health infrastructure at baseline and one for an infrastructure when we are in the middle of a pandemic. We didn't have one at baseline, and we certainly don't have one now during a pandemic. And one of the things I'm really going to advocate for, and I know the president-elect is advocating for, is to make sure that we have the resources for our public health system so that we can do the surveillance that is necessary for that testing.
You can set that up quickly enough?
They're working on it right now.
The president-elect has said that he's going to release all available vaccine supplies when he gets inaugurated. But then this week, there was just confusion about how much vaccine supply there actually is, whether or not there's a federal stockpile. Do you have a clear answer yet on how much vaccine supply this country has?
We have looked carefully, and we are confident that we have enough vaccine for the 100 million doses over the next 100 days. That is what the president-elect has promised. It will be a hefty lift, but we have it in us to do that. And in order to do that, we have to look at the supply for sure. We have to titrate and make sure that there are enough people getting vaccinated, but not too many as to overwhelm the system. So looking at our eligibility, and we have to make sure that there are enough vaccinators. I know that the president-elect has committed to use the Defense Production Act to make sure that where there are any bottlenecks in that supply, we will, address those bottlenecks.
Are there bottlenecks right now? Is there a production problem with vaccines?
I think that there are bottlenecks in different places across the entire system. As you look across the states in distribution, different states are having different challenges. How much is being rolled out to each state, whether those states have adequate personnel, whether those states are getting vaccine to pharmacies. And our job is to make sure that with the entire support of the federal government, that we address all of those bottlenecks wherever we are so we can get back vaccine into people's arms.
The president-elect has said he wants to try in his first 100 days to also reopen schools in the K through 8 age range. Yet we're looking at Europe right now, and they're reversing course in the UK. They're actually closing schools after they had been keeping them open. Given the new information about the new strains, is it still realistic to think you can reopen schools?
I think that this is a goal that the president-elect has. I share the goal. We are going to look carefully. One of the things we want to do is make sure that we can vaccinate our educators and people in our school systems. We certainly don't want to open schools if they are not safe. Among the things that we have to do is make sure that we have our transmission and our disease rates come down in those first 100 days. Between vaccinating the teachers, resources that are necessary to get those schools adequately equipped, and getting our K through 8 kids back, that is the anticipated goal.
Doctor, thank you for your time today, and we hope to have you back as CDC director to inform the public. We'll be right back. We want to go now to former FDA Commissioner Dr. Scott Gottlieb. He sits on the board of Pfizer and Illumina, which is a company that is working on sequencing the virus variants. He is in Westport, Connecticut this morning. Good morning to you.
Good morning.
You just heard the incoming CDC director say 500,000 deaths by mid-February, that this will get worse. Do you agree?
Yeah, I think tragically that's right. What we're likely to see is infections start to decline. I think we're seeing it right now. We're seeing a near-term peak in terms of the number of new daily cases. Now, unfortunately, deaths and hospitalizations will continue to grow over the next 2 or 3 weeks because they're a lagging indicator. But we'll see continued declines probably for about 4 weeks, maybe 5 weeks, until this new variant starts to take over. Right now, this new variant is about 0.5% of all infections nationally. There's hotspots in Southern California and Florida that may be closer to 1%, but it's going to double every week. So it's about doubling every week. That's the experience from other countries, and that's the experience we've seen so far in the United States. So it's 1% now, it'll be 2%, then 4%, then 8%, then 16%, then 32%. So in about 5 weeks, this is going to start to take over. The only backstop against this new variant is the fact that we will have a lot of infection by then, so there'll be a lot of immunity in the population, and we will be vaccinating more people. But this really changes the equation, and I think what we're looking at is a relentless strike from this virus heading into the spring, whereas infections really would have started to decline in the spring. We would have had a quiet spring. We could have persistently high levels of infection in the spring until we finally get enough people vaccinated.
I want to clarify there because we just spoke with the incoming CDC director who recognized that there is not a good surveillance system in place to figure out these new mutations. The numbers you're citing, they're from the private sector?
Well, Illumina, the company that I'm on the board of, is doing a lot of the sequencing work right now, and unfortunately the sample is very small. We should be sampling about 5% of all the positive cases. We're doing a lot less than that. We're doing well under 1%. We haven't found any of the B1351 variant, that's the South African and Brazilian variant, but we have just started looking for it. What we're finding is B117, so it's about 0.3 to 0.5% of all infections as of this weekend, data that's available right now. But it's going to increase, and we've seen it double already week over week. So this information is available. Illumina's tweeted some of it out. Their partner Helix has tweeted some of it out. They're working with CDC on this. So the data is starting to be available, but as the CDC director said, we're not doing a lot of surveillance work right now, so we're probably not detecting the full scope of what's underway in this country.
Americans now aged 2 years old and up will have to show proof of a negative COVID test to re-enter this country, even if they're a citizen. Will that make a difference, these kind of travel restrictions, in reducing these other strains from permeating?
Well, it's going to have some impact. I think it's hard to estimate how much it's going to really affect introduction into the United States. And the bottom line is these strains are already here. Even B1351 is probably in the United States now, even though we haven't detected yet. I think testing people as they come in, you're going to catch some cases, but it's also going to be a deterrent. People who think they might be infected or might have been exposed to someone who's been infected, if they know there's a surveillance system in place, they're going to be less likely to get on a plane because they're not going to want to get caught in a quarantine. So I think it's going to be more effective as a deterrent than actually catching positive cases as they come in. But it's something, it's something that we can do. I just think we need to be honest with ourselves that these strains are here right now. We need to start taking action. The simple things are still going to work. Wearing masks, avoiding crowds, and the quality of the mask really matters right now. If you wear a higher quality mask with this new infection, that's going to be very important.
That means surgical or N95, and B1351 is what you're calling South African strain, is that correct?
Right.
Okay.
Right, that's the South African and the Brazilian strain.
And the Brazilian, okay. Everyone take notes. I want to get you to the vaccine now because this just puts more and more pressure on getting protection out there for people. What is the bottom line? I asked the incoming CDC director if she had a good read on supply. She still thinks they can hit that 100 million mark with vaccinations. You sit on the board of Pfizer. What do you know about supply?
Yeah, I think they will hit that 100 million mark. I think the issue is going to become demand. I think they're going to have the supply in place and the distribution in place to do that. Right now, 30 million doses have been shipped to the states. About another 15 will be made available to the states as of this Tuesday, and 5 million have been ordered by the states but not yet shipped. So that's a total of 50 million doses. And there was a very small bolus. I think the plan that the new administration put out makes a lot of sense. It's sort of an all-the-above approach, what we've been talking about, trying to push this through different channels like the big box stores, like pharmacies, trying to set up more federally chartered sites in conjunction with the states. You look at a state like Connecticut, the state that I live in, I think that they've been taking that approach, and you see it working, where they've turned to the National Guard early. They set up a diversity of sites to distribute this. They've targeted high-risk groups, high-need groups, but they've also recognized that every vaccination is important. And so when people got vaccinated out of turn, they didn't impose fines, they didn't impose penalties, they didn't impose restrictions. They tried to get out all the supply, and the state's been successful. It's one of the leading states in the country right now in terms of getting people vaccinated. I think the federal plan that the Biden administration is modeling builds off what some states that have done well have done.
Those numbers you were citing, that's according to Pfizer? That's according to Operation Warp Speed?
Well, that's according to Operation Warp Speed, and I obviously have some insight into the one manufacturer, Pfizer, sitting on the board. I do think that there's ways that the administration can work with the companies to increase supply. It's going to take time, but there's machines that can help produce more vaccine. There's inputs that they can try to increase the supply of. And there might be things you could do on the fill finishing as you bottle the vaccines, trying to get additional doses out of the way you bottle the vaccines, making that process more efficient. I think it's going to be slow, but I think we can potentially eke out more supply with a full court press on all the different things that you can do to try to increase the inputs and the outputs here.
All right, Dr. Gottlieb, thank you as always for your insight. We'll be back in a moment. We want to take a look at what's on the minds of Americans as we begin a new administration in these very troubled times. CBS News Elections and Surveys Director Anthony Salvanto is in Westchester County, New York. Good morning to you, Anthony. We are on the verge of a big change politically, but Americans are on edge. What do they see as the biggest threat to them right now?
Yeah, good morning, Margaret. It is indeed a portrait of a country on edge after the events of the last few weeks. When we ask that very question, what is the biggest threat to your way of life right now? More so than foreign adversaries, more so than things from the natural world, disasters, even viruses. People said it was other people in America, domestic enemies. And have a look at this. Even though the Capitol is certainly on edge this week, Americans feel that political violence may increase over the next few years, so hardly out of the woods. And more broadly, Margaret, I would say that although we'll hear a lot about political divisions and a divided country, rightly, in the next few weeks, you know, Americans feel that democracy itself is threatened, and very few report that they feel that it's secure. These are much more fundamental concerns, Margaret.
Anthony, it's so disturbing what you're laying out here. Is there any sense that it's going to get any better with the Biden administration?
Well, there certainly is optimism, majority optimism, about the next 4 years with Joe Biden as president. I would say these are very partisan divisions, but it is there. Now, the other thing to look at is Joe Biden's opposition in Congress, the Republicans. And here is a party that also seems very much divided. Look, half of Republicans, their rank and file, want their party in Congress to try to find common ground with the Biden administration, but half want them to oppose him as much as possible. And you take a look at this, where half of Republicans say they will still not consider Joe Biden as the legitimate president even after he is sworn in. And who are these folks? Well, this half are more likely to be the strongest Donald Trump supporters, the kinds of folks we've seen over the last few years who even consider themselves to be Donald Trump supporters first, even more so than Republicans, Margaret.
So that suggests that President Trump's grip on the Republican Party doesn't go away when he leaves office?
It really doesn't, at least not in part, at least not for that sort of core base of the base. In fact, when we talked about impeachment, these are the folks who were more likely to say that the Republicans who voted for impeachment were not principled, but were disloyal. Margaret?
Anthony Salvanto, thank you for your insight. We'll be right back. Big news from us here at Face the Nation. We're launching a new podcast this Friday called Facing Forward. I'll be talking with the business leaders and policymakers who make the decisions that impact every American. You can subscribe on Apple Podcast or your favorite podcast platform. That's it for us today. Thank you for watching, and we will see you Wednesday for the inauguration of Joseph R. Biden Jr. Our special coverage begins at 9 a.m. For Face the Nation, I'm Margaret Brennan.